Downing Street came an all-too-familiar message. A virus again out of control, a country again locking down to stop it.
Sa nakakabahalang pagtaas ng bagong variant ng coronavirus dito sa Inglaterra, napagpasiyahan na ilagay na ang buong Inglaterra sa national lockdown o ang Tier 5, ang pinakamataas na restriksyon sa mga tao at sa mga mamamayan nito. Idineklara sa buong bansa ang national lockdown at ang national health emergency dahil sa patuloy na pagtaas ng mga na-infect ng coronavirus na ito at ang aming mga ospital at mga ICU ay puno na. Inaalala nila na baka hindi na ito cope sa mga dumarating pang mga pasyente na na-infect ng virus na ito. Panoorin ang buong detalye. Salamat po.
As I speak to you tonight, our hospitals are under more pressure from COVID than at any time since the start of the pandemic. In England alone, the number of COVID patients in hospitals has increased by nearly a third in the last week to almost 27,000. And that number is 40% higher than the first peak in April. It's clear that we need to do more together to bring this new variant under control while our vaccines are rolled out. In England, we must therefore go into a national lockdown which is tough enough to contain this variant. That means the government is once again instructing you to stay at home. Why we did not take this decision sooner? We've been doing everything in our power. If the rollout of the vaccine program continues to be successful, if deaths start to fall as the vaccine takes effect, and critically, if everyone plays their part by following the rules, then I hope we can steadily move out of lockdown.
These measures are necessary and it's really important that we all support them. These are going to be really, really tough weeks now, and I think all of us need to pull together to try to get through this. We're asking a lot of the British public. In return, we have to deliver the vaccine.
Weeks ahead will be the hardest yet, but I really do believe that we're entering the last phase of the struggle, because with every jab that goes into our arms, we are tilting the odds against COVID and in favour
in Liverpool tonight,
of the
streets
people.
are already all but deserted. A city that began the day in Tier 3 will tomorrow, like the rest of the country, wake up yet again in a national lockdown, in which it will remain for at least 6 weeks.
Case rate increased by 70%.
When everybody looks at the position, people understand overwhelmingly that we have no choice. When the Office of National Statistics is telling us that more than 2% of the population is now infected, that's over 1 million people in England.
Across the country as a whole, roughly 1 in 50 people have got the virus, higher in some parts of the country, lower in others. But 1 in 50 is really quite a very large number indeed.
Every part of the United Kingdom is now in lockdown, with people being urged to stay at home as the scale of the public health emergency becomes even more daunting. Such is the depth of the COVID crisis that the lockdown measures are widely expected to remain in force probably until March. Now, today's figures tell their own story. The number of new cases reported in the UK in the last 24-hour period is more than 60,000. That is for the first time since the pandemic started. In England, more than 1 million people are currently infected, and that figure is based on 1 in 50 people living in private houses. Now, record numbers of people are in hospital with COVID, putting huge strain on the NHS and its resources. And the government's advisors say that some restrictions may still be needed next winter to try to keep the virus under control.
Here we go again. Across the UK, a return to deserted streets, empty classrooms and closed shops. All hopes now pinned on a speedy vaccine rollout. Until then, what will life be like? And for health workers like Nassim, it's going to be more long shifts in hospital. Chief Medical Officer said the country now faced a really serious emergency.
If people don't take the stay at home seriously, the risk at this point in time, in the middle of winter with this new variant, is extraordinarily high.
Mr Johnson's promised to give regular updates on the progress of the vaccination programme. The aim is inoculating around 13 million people by mid-February. The Labour leader said the nation must pull together.
We now need the government to deliver for the British people. And that means using this lockdown to establish a massive, immediate and round-the-clock vaccination programme to deliver millions of doses a week by the end of this month.
The First Minister of Scotland said the new strain of coronavirus had driven everything off course.
It is transmitting so much more quickly. You know, this whole thing has always been a bit of a race with the virus. We've now got the vaccines that we hope can beat it. So we have to up our game again to try to get ahead of it. The vaccines will help us do that, but while that's happening, we need to work harder to slow it down.
We in government are now using every second of this lockdown to put that invisible shield around the elderly and the vulnerable. As of this afternoon, we've now vaccinated over 1.1 million people in England and over 1.3 million across the UK.
Vaccination is now well underway across the UK, including at this centre in Lincolnshire today. But is the process moving fast enough to meet ambitious targets? Here, they seem optimistic. The Prime Minister said 13 million people from priority groups would be offered the first dose by mid-February. Top of the list are care home residents and workers, then all aged 80 or over and frontline health and social care staff. The 75 to 79-year-old group comes next, followed by 70 to 74-year-olds and all who are clinically extremely vulnerable. The vaccine made by Pfizer has been available in the UK since early December, but it needs to be stored at very low temperatures, around minus 70 degrees. The Oxford AstraZeneca jab was rolled out this week. It can be kept in normal fridges, so is easier to distribute. There are vaccine challenges. There's a process known as fill and finish, where it's put into glass vials and packaged. There is a global shortage of these vials and so delays. So far, 4 million AstraZeneca doses have been through the process. Pfizer says it's delivered several million to the UK. Each batch then has to be safety checked by the Medicines and Healthcare Products Regulatory Agency. So far, 500,000 of the AZ doses have been cleared for use. Distribution isn't easy. The NHS will soon have 1,000 vaccination centres, from GP surgeries to football stadiums.
Latest data for the whole of the UK only goes to just before Christmas, but we know that since then cases have rocketed and admissions to hospital will follow suit. With nearly 61,000 new cases of the virus today, hospital staff are braced for some extremely difficult weeks ahead. Staff sickness isn't helping. Doctors and nurses, hospital porters and cleaners, like all of us, vulnerable to the virus. Managers declared a critical incident for some hours after a sharp rise in COVID patients requiring admission. Another sign, if it was needed, that right across the UK, the virus is now fast running out of...
Sadyang tunay na nakakabahala ang mga kaso ng coronavirus o ang bagong variant na ito na lumalaganap sa buong Inglaterra at kinakatakutan na rin nakalabas na rin ng bansa. Sa kadahilan na ang bagong variant ng ito ng coronavirus ay madaling makahawa, kaya biglang lumaganap o tumaas ang mga kaso at marami na rin binawian ng buhay dito sa Inglaterra. Ano nga ba ang dapat natin gawin kundi ang sumunod sa mga payo ng mga dalubhasa, kundi ang social distancing at ang ating personal hygiene at alalahanin na maging responsibilidad sa ating sarili, sa ating mahal sa buhay, sa ating mga kaibigan at sa ating mga kapwa-tao. Maraming salamat po at sana po ay sama-sama tayo magdasal upang sa ating kaligtasan at malayo sa anumang banta ng pandemyang ito. Salamat po. Mabuhay!